Hello, today's video is going to be on trying to work out multiple quadrants, or at least two quadrants, and how to sequence treatment when you're doing fillings on somebody and how you can probably make the best use of time during that procedure. Let's assume someone was going to be coming in, and if we were to put together our quadrants like this, and they were going to have a number 3 occlusal, number 4 a DO composite, and then let's say number 30 was going to have an occlusal as well. At the beginning, we would get numb both this quadrant and that quadrant. Let the patient set for a moment. Then when it comes time to prep, I will prep this one, and then I'll prep that one. Okay, I will prep and then I will fill later. The reason why I'm not going to prep and then fill and then come down here and prep and then fill is on the lower, the chance of anesthetic not working is a little bit higher than on the top. More times than not, the top is more predictable as far as getting anesthetic to take on the first shot. I'm sure all of us have been in the situation where you go to work on the lower and the patient still isn't quite numb. They need a second injection. So let's just assume that small percentage of the time that happens, but let's just assume that that is the case. If you prep here and you start prepping here and they feel it, okay, you can stop, give them the second anesthetic, the second cartridge. Then you can go back up to here, continue to work on these teeth. You've already prepped them, so now let's go ahead and fill them. You know it's going to take a little time to do a DO. You have to put in a sectional matrix, and you have to go through all those steps. And by the time you're done filling these, then this bottom one should be numb enough, or it should be numb at this point with that second cartridge, that you can now continue your prep and then fill that one. If you don't do it that way, you can see the problem. If you prepped and filled, and then you came over here and prepped, and then you realized they need a second shot, you'd have to give them a second shot, and then now just wait. You have to wait for several minutes to go by before you could go back in. Now you might be able to go do a hygiene check or do something like that, but the thing is like if you're sitting down with that patient, they want to get out of the chair just as fast as you want to get them out of the chair. So this is a way to kind of make sure you're kind of hedging your bets or hedging your losses in case your first injection doesn't work. So when you're prepping, always should be thinking ahead when you're doing these cases, how can I make the best use of time and prevent, or I should say, mitigate any downside you may have if you don't have a right off the bat successful injection. So thankfully these things don't happen that often, but they happen to all of us. So just knowing this, if you do it in this sequence, I think you're going to find you get a much better outcome. Oh, and one final thing, you want to prep both of them, fill all 3 of these, and then check the occlusion. Okay, if by chance you were doing a filling over here, let's just say number 12 was going to be an occlusal, and then number 13 was also going to be an occlusal, and you're going to get this all done in the same visit, I would prep. I would do this side first. I would prep, fill. Prep. Come over here and prep. Come back over here. Fill. Check the occlusion. Once that's good, now I can come over here. What I don't want to do is prep, fill, and then go to try to find the occlusion, because the problem is they bite down on the paper, and let's just say this one's hitting high, so you get that one adjusted. Then this is hitting high, and then you have to come over here, and now maybe it's kind of bouncing back and forth. It's almost like whack-a-mole. It's like which one is going to be the next highest occlusal spot that's hitting. So if you do one side, get it done, and then go to the other side when it comes time when you're checking the occlusion, then that's the way to do it. And the only way you can do that is if you fill one side first and then go to the other side and fill. At least the way we do our articulating paper is we find that we have to get all the surfaces dry. And we have to put in cotton rolls and dry angles and dry it all off. That takes time. So if you're going to do that, let's just work on one side, get it done, then move to the other. So hopefully this will kind of help in making your real-world clinical dentistry a little bit more efficient. Thank you.